I'd like to welcome everybody to another podcast today from Odelle Technology. We're talking to the wonderful Professor Sally Lewis. Hello, Sally.
Hello, Stephen.
It's very good to see you again. Sally, I wondered if you wouldn't mind telling the audience a little bit about yourself and how you ended up where you are today, please.
Oh, thanks, Stephen. It's a pleasure to be here. So I'm a general practitioner by background, or family physician in US parlance, I guess. And I practiced and ran my own practice for 24 years or so. That was my background. And about 15 years ago, I also picked up some roles in our integrated healthcare system in Wales as primary care clinical director, and then assistant medical director. And it was during that time that I really became interested in whole system transformation, pathway redesign across whole pathways of care, and ultimately value-based healthcare, which led me to where I am now.
So where you are now is a National Clinical Lead for Value-Based Healthcare, correct?
Well, I was until July of this year, last year, July 2024, as I became interested in value-based healthcare when I was assistant medical director of a health board in Wales. We set up a programme of work on value-based healthcare, which I'll explain a little bit more about probably later in the podcast. And that grew then into a national programme, which I led for the last 6 years, establishing the Welsh Value in Health Centre. And then left the NHS in July last year, really to continue to pursue the mission of value-based healthcare internationally, because I firmly believe that it's through international collaboration and working with each other at a policy level, at a healthcare system level, and at a direct patient care level, that we are going to solve the problems that we see in healthcare systems today. So I left and I became a part-time part-time professor of value in health management at Swansea University, and set up Kintsugi International, which is my own independent consultancy looking to forward the agenda of value-based healthcare around the world.
All right. So can you share more about your role as a Professor of Value in Health Management at Swansea University?
Yeah, sure. So while we were working on value-based healthcare in Wales, we realised very quickly that it required a huge cultural shift within healthcare systems, very much towards a focus on outcomes that matter to patients. And as a clinician, that really, it was a big light bulb moment for me. God, I've been practicing medicine all these years, and I hadn't really thought about why we didn't have a focus on outcomes that matter to patients as a way of informing how we improve the system and improve how we allocate resources across the system as well. So huge cultural shift, and we realized this very early, and we realized that to support that cultural shift, there would need to be a systematic approach to education and engagement across the system with colleagues, not just clinicians, but a multi-professional approach. So at the beginning, that educational and engagement approach was very informal, and we really started off, or I started off anyway, by bribing people with coffee and cake in the hospital coffee shop, to be honest with you. And that then grew into slightly more formal seminars and so on with professional societies. And then eventually, an intensive learning academy was funded by Welsh Government at Swansea University. And my colleague, Professor Hamish Lang, established the Intensive Learning Academy for Value in Health, which sits within the management school, actually, in Swansea University. And that is where I now have a part-time chair. And really the mission of that is around informing and educating around the principles of value in health, around creating case studies. So we're very interested in case study writing for where there have been successful examples of, real life implementation of value-based healthcare approaches, not just in Wales, but internationally as well.
So what are you able to tell me about Kintsugi International?
Well, when I left the NHS, and during the course of working on value-based healthcare over the last 7 or 8 years, I had the privilege of forming a wide network around the world, in Australia, the US, Middle East, and Europe, with people who were trying to forward the value-based healthcare agenda. And because it is such a cultural shift and requires a degree of infrastructure to be built to support it, particularly digital and data infrastructure, it needs everybody pulling in the same direction all of the time. And that's why we need this international collaboration, and we need work done at a policy level, at a system level, and at an individual practitioner level to support that change. And so Kintsugi International was set up really to achieve those aims and support policy, international health policy towards a focus on outcomes and value, to support healthcare system transformation, and in a very practical way. So, policy is quite high level and statements of intent, isn't it? But my consulting includes hands-on support for implementation and for value-based healthcare strategy within organizations, and that includes industry, because we need industry partnerships as well in all of this, and also in what this means actually for patients and the public, and what this means for healthcare professionals, doctors, nurses, and allied healthcare professionals.
Okay, so with the growing focus on value-based healthcare, where do you see the healthcare industry heading in the next 5 to 10 years?
Well, it's a sobering fact that all healthcare systems around the world are basically on an unsustainable trajectory. Now, that's quite a provocative comment, which I'm sure many would challenge, but I've had the privilege to visit many different countries, and it is an absolute truism. The thing is that we see that play out differently depending on the context of the country. So where there is pressure on an overall healthcare system, you either see increasing inequity between those who can access the best care and those who can't, and therefore you see inequity of outcomes at a population level, or in what you might call a more socialized healthcare system like Wales, where we try to spread the jam across everybody, but the jam gets thinner and thinner. Everybody gets a service that is, slightly less good, and the wheels start to fall off the wagon, which is why we see waiting lists, ambulance queues outside hospitals, and this kind of thing. And the reason for that unsustainability is because we're fundamentally not meeting the needs of our population in the community now, despite having healthcare systems which haven't really changed that much over the last 50 years. So we really need to tackle this unsustainability within the system, and that requires looking at new models of care. It requires some honesty at a policy level, and it requires patients to be much more involved in their care as well, whether that's with digital enablers, or whether it's just being supported in a different way to manage chronic conditions, for example. So there are all these interventions that we need to make if sustainability of healthcare systems and good outcomes for all are our aspiration over the next 5 years, Stephen. And what I felt in my role as a GP in Wales was that looking at value and a focus on outcomes and how we use those resources in a really forensic way was the only way that we were going to really start to create that more sustainable approach to healthcare. And if we don't do that right now, in 5 years, we will see growing pressures and or inequities everywhere, I think.
Absolutely. So Sally, how do you approach resistance from stakeholders who are skeptical about moving away from the traditional volume-based care models?
Yeah. Well, I think where I would start is where we would agree. So what I would pose the question, do you think that the current state of affairs is sustainable? A bit of a leading question, but if people believe that it is sustainable, then that's a good place to start the debate, isn't it? But I think most people would agree that things are not sustainable. And then I would say, is it desirable to focus on outcomes that matter to people and to do that equitably? And most people would agree with that. Equity is relates to people's values and the value judgment they might make around that, and different systems are more focused on equity than others, as you know. But I think if we start where we agree, which is yes, we have an unsustainable system, yes, we should focus on outcomes, then I think you can take people down a bit of a decision tree, if you like, around whether value-based healthcare is the right way to go. I think a lot of the pushback around value-based healthcare, to be honest with you, is a misunderstanding that it's just about cost cutting, which of course it's not, or it's about giving everybody everything they want all of the time, which of course it can't be. So I think by being open and also accepting the limitations, I mean, no approach, no methodology is without its limitations. So it's not a panacea, but it is a helpful approach to solving those wicked issues within the system.
Sally, can you tell me a little bit about what value-based healthcare looks like, please?
Yeah, so as I said earlier, it's about sustainable use of resources, including human resources, but very importantly, focusing on using those resources across a whole pathway of care, from prevention through to end of life, and really focusing on the outcomes that matter to people. So it's quite data-driven. It forces us to have data-driven decision making from the boardroom to the bedside, and also at a policy level as well. So how do we improve outcomes? Well, there are many, many different factors from a patient side, from a policy side, and from a system side to improve those outcomes. For example, we need to raise health literacy, don't we, in the population, so that people can really interact with their healthcare well. Take their medicines, do what is necessary to manage their chronic illness or prevent disease. But we also need to be adopting new technologies and reducing unwarranted variation in care and reducing low value care. So there are many, many, many interventions. It's a very big, very complex field. So to simplify that, I like to think of it as, how do we increase value at a population level? And then at a pathway level, from prevention through to end of life, and then at the level of the individual patient, what matters to that person, and how do we achieve that individually? And chunking it up that way, I think, helps people to not try and eat the mammoth in one go.
Has your experience at NHS Digital Academy influenced your approach to integrating digital health technologies into value-based healthcare?
It absolutely has. So when I became interested in value-based healthcare, one of the proofs of concept was, well, is it even feasible to collect patient outcomes, particularly patient-reported outcomes, where we're sending structured questionnaires, assessments, patient-reported outcome measures out to people and asking them to report on their symptoms and their quality of life. Is that even feasible? So as soon as you start doing that, you realize actually this is not just about sending out a questionnaire. It's about enhancing communication with individuals, with patients. And if you want to do that at scale, you need to do it digitally. That doesn't mean you can't do it in other ways for other people who can't use digital tools. But to do it at scale, you need to be communicating with people digitally, and collecting that data in such a way that it can be used for lots of purposes afterwards, whether that's in direct care or linking it to other data to understand what effective care looks like. So that instantly took me down a digital and data rabbit hole, Stephen, and it drove me mad because there's a running joke in my family, you know, because I was the last person to have a mobile phone. I was not particularly interested in technology whatsoever, and then I got interested in this, and suddenly, yeah, I had to learn about it. So I did go to the Digital Academy and ended up getting a master's in digital health, just so that I could communicate better with informaticians, with the data analysts, and understand about issues like interoperability and user-centered design and all of those things that are so important if you're going to deploy digital technologies. And for my particular interest, which was deploying digital technologies for two purposes. One, to enhance communication with patients, and as a part of that, collect patient-reported outcomes from them. And secondly, what were the opportunities with digital technologies for supporting new models of care that contributed to the sustainability of healthcare systems, for example, by allowing some remote and asynchronous care and stopping the need for people coming to arbitrary 6-monthly outpatient appointments when they didn't necessarily need to.
Okay. So what role do cross-sectorial partnerships take or play in advancing value-based healthcare? And how could a smaller organisation or a startup contribute?
Interesting question. Well, in my experience, I mean, this is one of my biggest lessons, to be honest with you, of the value of multi-professionalism and also cross-sectoral partnerships. Absolutely fundamental if we're going to create this cultural shift within the system. We have so much to learn from each other. And I think, where can startups fit in here? Well, startups are innovators, aren't they? They have wonderful ideas. They're disruptors. They will not be ingrained in the legacy of decades of, well, this is how we do it around here. And I think that's where they can really add value. The challenge for startups is getting through the door and getting people to listen to them, I think, in that regard. But I think if startups can begin to form partnerships with innovation accelerators. So in Wales, I would use an example of Tritech, for example, which is a unit in one of the health boards which works with industry partners to develop innovation ideas. And there are other units in other countries around the world that I'm aware of. But getting in the door, getting their disruptive ideas developed a little bit more, and then the role of the health system then, I think, is to help the startups understand the context of the healthcare system and the landscape, so they can understand how to develop that product to the next stage so that it is likely to land better in the context of that landscape. But oh my goodness, do we need disruption in healthcare?
Indeed. So what advice would you give to a healthcare professional aspiring to transform into a strategic or advisory role in healthcare systems?
I can only give my own experience in that. And my experience of this was, I didn't set out to be that. I got interested in something and frustrated and trying to solve a problem. And in trying to solve that problem and being intensely curious about it, that leads you to take on additional roles, sometimes pro bono. You know, sometimes some of the early roles I had in this were not paid roles, they were not formal roles, they were between the cracks. So start there, offer up your time, be curious, get interested. And then those informal relationships tend to develop as the work grows into, more formal arrangements, actual jobs.
So from your rather remarkable career, what would be the pivotal moments?
Pivotal moments. When I arrived, there were about 3 or 4, I would say. The first one was arriving back in Wales, coming to my practice, seeing differences between the Welsh and English system, being frustrated and therefore being annoying, and beginning to email the health board to say, "Have you, what about this? What about that?" And then they said, "Oh, well, okay, well, why don't you come and join this meeting, and you can help us with this piece of work," which I did for free. And then after that, when a clinical director post came up, they rang me up and said, "We would like you to apply for this." And I said, "No, don't be so daft. I'm not qualified to do that." And they said, "Well, who is? You just have to do." So I would not have applied for that role had that person not actually persuaded me to do it. And that was a person who I'd worked with on a project that I'd just got interested in and contacted them about. So because I wouldn't have considered myself as being qualified. So I would just say, if people offer you an opportunity, say yes.
Absolutely.
Always say yes, and then work out how you're going to do it later, and sort of fake it till you make it kind of thing.
Yeah.
And then the next opportunity was the finance director in the Integrated Health Board, where I was an assistant medical director, introduced me to value-based healthcare. And he gave me the best opportunity in the world, which was to give me a blank sheet of paper and say, "Go off and find out what it takes to make this a value-based healthcare organization." And so I did. I took him at his word. So you have to be a self-starter. You have to sometimes proceed until apprehended. All of these cliches, seek forgiveness later and all of those, you just have to go for it. And if somebody gives you an opportunity, say yes, be a self-starter. Don't expect that anybody is going to tell you what to do or give you the answers. And then things evolve and things happen. So that would be the next opportunity. And then again, the next opportunity was when the national role came up, and I applied for that. And yeah, so say yes and be brave. So leaving the NHS after 30 years, basically, last year, was, I mean, you could say I was pretty institutionalized in a way after 30 years. So, so I don't mind saying, it's pretty scary to step out. So challenge yourself. You don't have to scare yourself as much as maybe I did last year, but a certain amount of bravery and taking calculated risks, I think. But
Absolutely.
most of all, being curious and just following what matters to you.
Well, you've done that very, very well over your life, and I'm sure it's going to continue. I wanted to wish you all the very best of luck, and I've really enjoyed talking to you and listening to your story today.
Thank you. It's been a real pleasure.